Hello and welcome back to another video of Special Tests with Canon, Elizabeth and Scotty. We're going to be going over a few more special tests, this time specifically focusing around the knee. And yeah, just the knee. First test that I will be doing is the lever sign test. Now this test is going to be performed by putting a fist underneath the middle of the calf so that the heel is just barely on the table. You will then apply a force against the upper leg or the femur and to see if that heel comes off of the table. If it does, as you can see Scotty's, that will indicate a negative test. A positive test would be if you press down and the heel does not come off the table. That could indicate that there is an ACL sprain or tear. The second test that I will be going over is the Apley's distraction and then compression tests. Scotty, if you will go ahead and flip over. First, for the distraction test, we're going to grab the leg and bring it to a 90-degree flexion. And then with placing one hand over the back of the leg and putting a pressure down into the table, and the other pulling upward and externally and internally rotating the foot, you will be checking to see if there's any pain. And is there any pain as I do this?
No.
There's no pain. All right. In that case, that would be a negative test. A positive test would be a pain as you rotate. The compression test is done slightly different, where you're going to put some pressure down through the shaft of the tibia. You can go ahead and keep that femur stable, and then you're going to externally and internally rotate that foot one more time as you give that compression. And if there's any pain during that will indicate a positive test and possible meniscal tear or sprain. Was there any pain as I did that?
Yeah, a little bit.
Where at?
Just
Right through in your knee?
Yeah.
Oh, okay, sounds good. So it's possible that dear Scotty Busher needs to go and get surgery. The next test that we'll be doing is the patellar apprehension test. If you'll go ahead and flip back supine. The way this test is performed is by simply pressing both laterally and medially the patella, and you're looking for any apprehension or flexing of the muscles because it's painful or they're just unsure about the movement. So as you come and test this bilaterally, you might notice that there's some apprehension there. That would be a positive test and indicating that there is a possible patellar subluxation or that one has occurred. The Noble compression test is our last test of the day. This test is going to be testing to see if there is iliotibial band syndrome. Go ahead and lay back down. The way this test is performed is by putting pressure along near the insertion of the iliotibial band, or your IT band, as many call it, and you will bring their leg all the way through the full range of motion. And as you put the pressure along that IT band near the insertion, you'll just bring it through the full range of motion. If there's any pain as you go through this, that may indicate that there is iliotibial band syndrome. So Scotty, any pain? Anything? No?
I don't think so.
All right. In that case, all he needs to go do is get his meniscus repaired. Thank you for joining us.
Hello, I'm Elizabeth. Today I will be performing 5 special tests for the knee. The first test that I'll be doing is the anterior drawer test. So we'll have the patient bring their knee into knee flexion. And then this test is performed to see if there's a ACL sprain. And so what we'll do is I will apply a force to the tibia, which will translate it forward. So, and I'm looking for laxity, so I'll compare bilaterally, and if one side has more laxity than the other, that could indicate an ACL sprain. And then the second test that I'll be doing is the posterior drawer test. That one is very similar to the anterior drawer test, so it's used to see if there's a potential PCL sprain. And so instead of an anterior translation, we're going to translate the tibia posteriorly. And then we're looking for laxity, so we'll compare bilaterally, and if one side has more laxity than the other, that would be a positive test and could indicate a PCL sprain. Okay, and then the third test that I'll be doing is the valgus stress test. So I'll have the patient relax their leg, and then we'll be applying a valgus stress, so a stress that will stress the MCL, and then this one we're looking for laxity as well. Okay, and then this one, since we're looking for laxity, we will check bilaterally. If one has more laxity than the other, that could indicate an MCL sprain. And the next test that I'll be doing is the McMurray's test. And this one is used to see if there's a meniscus tear. So we'll have the patient start in knee flexion, and we will first externally rotate their tibia and apply a valgus force. And this will be assessing the lateral meniscus. And then we'll move them through knee range of motion. And a positive test would be if there's painful clicking. Did you feel any pain?
I felt clicking, but not pain.
Okay, so that would be a negative test because no pain was felt. And so the other half of this test, we will internally rotate the tibia and apply a varus force. And this will be assessing the medial meniscus. And then the same thing. Is there any pain when I do this?
No pain.
Okay. So a painful clicking would be a positive test, and because there is no pain, that's a negative test. And then the last test that I'll do is a measurement of the Q angle. So we'll have the patient with their knee extended, and if we had a goniometer, the center of it would be over the patella, over the knee joint, and the stable arm would be in line with the ASIS, so lined up with their femur, and then the stationary arm would be in line with the tibia, just like that. And if their measurement was less than 10 or greater than 18, that would indicate excessive angulation, which could put them at risk for potential knee injuries later.
Hi, I'm Scotty Busher, and today I'll be doing 4 special tests for the knee. My first test I'll be doing is Lachman's test. And so I'm going to have Elizabeth lay down, and first I'm going to ask her to put into external rotation and a slight bend in the knee. And I'm going to be putting my hand to stabilize the femur, and then putting my right hand posterior to the tibia, and I'm going to be pulling this anteriorly, an anterior translation, and I'm going to be doing that. And I'll be looking for laxity in the knee, and I'll be doing that bilaterally. And if there's any extra laxity in the leg or the knee that they came in asking about, then that'd be a positive test for an ACL sprain. Since it was negative, then she's good to go. The next test I'm going to do is the varus stress test. So I'm going to be grabbing the leg and slight bending it. And I'm going to put it under my arm to kind of get her leg free and make sure it's nice, relaxed, and loose. And I'm going to be putting some varus stress. And after that, I will be again looking for laxity, and I'll be doing that bilaterally and looking to see if there's any extra laxity in that leg or in that knee. And was there any? No. And since there's no laxity in that knee, then she's just a negative test. A positive test would be there would be like extra laxity in that leg compared to the other, which means that'd be a possible LCL sprain. Next, I'll be doing Thessalie's test, so you could stand up. And if they need extra balance, I can hold their hands. And if you want to stand on one leg and slightly bent, and turn externally and internally to the left and to the right. And then once that's finished, do you feel anything? No? Okay, you're good to go. You can come sit back down. And since you didn't feel any pain or feel anything, then that would be a negative test. A positive test would be feeling any pain, and that would mean a possible meniscus tear or a meniscus injury. And last, I'll be doing the patellar grind test. And for this one, we're just looking to see if there's any pain when the patellar moves. So I'm going to first ask her to tighten her quads. And do you feel anything there? Okay, sweet. I'm going to put some pressure on there, and if you can tighten your quads again. Do you feel anything there? No, I'm going to put a little bit more pressure. Tighten your quads one more time. Do you feel anything there?
No.
And we're just looking for pain. So since there wasn't any pain at all, then that'd be a negative test. And if a positive test would be if you're feeling any pain at any point of that this test, and that would mean that a positive test would give chondromalacia or possibly patellar femoral syndrome. And those are the tests for today.